Asking for help is never easy. Kathia Sanchez knows this because she sees it every day. As the manager at the Rose's Southeast location, 3 departments fall under her leadership: medical records, registration, and sponsorship. Kathia is the person who makes sure that every patient is taken care of. She's the one that is there from the time you make that first phone call, to setting that appointment, to coming in, to all the other things that your medical records require. She understands what it's like to have to ask for help, and she makes sure that all of our patients are handled with dignity and, most of all, compassion. One appointment could change your life or that of someone you love. So please, schedule your mammogram and pass this episode along to someone who needs to hear it. And we so appreciate every time you go to therose.org and your support of our mission. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Kathia, let's talk about your role here at The Rose.
Yes, so I am the center manager here at the Southeast location. I oversee 3 departments, which is the medical records department, the registration department, which that includes our sponsorship, and our call center.
You've always been in healthcare of some kind.
Yes.
And I remember a story you told me about you had applied here a few years ago and didn't get the job, and now you're back here as a supervisor, a manager. I mean, my goodness.
I did. So I was going through my emails the other day, and I came across this email that I sent Araceli, which is our Galleria manager, and Jeannie, which is our imaging manager over there. And I was almost begging them for a job as a scheduler. Nice. And, of course, I didn't get the job. But 12 years later,
here you are.
Here I am.
The Rose picked you at the right time.
At the right time.
Because you were ready to be a supervisor.
I was.
Yeah. And we are so pleased that you have come to be with us.
Thank
because you really have made a difference with our patients and our employees. And, you know, with your healthcare background, what have you seen that's different here at The Rose?
The Rose operates from a place of mission, not profit. So when patients come here, we're not only providing care, but we're providing access to it.
And what does that mean to you?
So we are removing all the barriers, language barriers. We have all of our staff speak Spanish or other languages. So that's a big plus. We have our sponsorship programs that, removes those financial barriers. So So
speak to those just a little bit, because I really want our listeners to understand how sponsorship works. I mean, I know you know the story that we decided to call it sponsored. A person sponsors an uninsured woman, as opposed to saying you're giving charity care or you're helping the indigent or we hate those kind of terms. We wanted that woman to understand some other individual was sponsoring her. So just explain the program.
So the program consists of when the patient schedules an appointment, we speak to the patient and we just review, case by case. What are their financial barriers? What are they going through? Any difficulties at home? And then we just go from there. We do have guidelines that we have to follow for, certain programs that we offer. But we give all of our patients, whether insured or uninsured, the same type of care. And we respect every patient, regardless of if they pay or not.
So some of the criteria has to be they meet that financial income level, which is 200% of poverty, which isn't a whole lot, but, we have a lot of patients that meet it.
Yeah.
I think it was over 8,000 last year. Yes. And they cannot have insurance.
Right.
But you and I both know many of our women who eventually end up being sponsored start as a cash pay.
Correct.
So why is it so difficult for someone to ask for help?
Well, I think that asking for help is hard because you have to admit there's a problem. And women are strong. Women are caretakers. They're providers. So admitting that there's something wrong, it's like admitting that you're weak, which is not the case. So
I never thought about it like that. Admitting that you're weak?
weak, yeah, which is not the case. It's just
No.
you put everybody first and then you put yourself last. Because
But you would ask for your child.
Right.
Right.
And that's where, putting yourself last because you feel weak. That's the problem. Well, I feel like that's the problem.
No, and well, you're talking with the patient, so I trust that you would hear different things than I would think.
Yeah.
But I know it's hard for anyone to ask for help
Right.
in a lot of ways, but this has to do with your health.
Mm-hmm. Right.
And maybe you've already found a lump or something's wrong with your breast and you know it.
Yeah.
So when you say we look at case by case, does that mean I get asked a whole bunch of questions?
No. So, we asked the guidelines, the questions that just depending on the program, but we try to understand what someone is going through first. We're not asking, I need to see your last 3 check stubs. No, we try to, ask the patient, what's going on? Why are you seeking, sponsorship? So we try to make a relationship with them first before we even mention our sponsorship.
So, how do you relate to these patients, to our patients, you personally?
Well, I do relate to these patients because I know how difficult it is to navigate the healthcare system when it can be very intimidating. So I grew up helping my parents, my mom, navigate the system, translating. So some of these patients, when they call and they're scared, they found a lump, I feel like I need to guide them, educate them, and provide the best care for them.
So you see your mother sometimes in our patients? Yeah.
I do.
And as a child, how did you feel?
Oh, it was hard, having to translate medical documents at the age of 10 and advocating for my mom at the age of 10 and, asking the doctor, why does she need to have this done? And when I didn't even know what it meant. So, it was hard.
So what gave you that courage to do that? A lot of people don't ask doctors questions.
Well, I had no choice. We had no choice. So it was a language barrier. So, I don't know if back in the day if they had translating services.
No.
Okay.
It wasn't required.
It wasn't required.
Yeah, and so it wasn't required. Guarantee you it didn't get done.
Yeah. So here I was, a 10-year-old, reading results. And it was hard. It's sad to think, that you had a child advocating for an adult. But I'm proud of it because it shaped me to be the woman that I am now.
That's so true. And we have that happen sometimes.
Yes.
Even though we have Spanish speaking, and sometimes it's more than just the language. It's the health care that is so hard to understand. Why do I need to do this? Why am I having to go have another test? What have you found when we haven't found anything yet, but we still need to do it? And especially when we diagnose someone.
Right.
So what happens then? I have no insurance. I don't speak the language, but now I have breast cancer. What happens?
Right. So we have our patient navigators here, which they're bilingual. By the time they get to the patient navigators, the navigators already know their case. So what they do is they navigate the patient and find resources for the patient to seek care.
And so that means that the way that we do it, and correct me if I'm wrong, but the navigator is sitting in the room with the doctor as the patient hears her diagnosis.
Correct.
So that patient knows that person's going to be with them from then on.
Correct.
Yeah. And then she helps her fill out paperwork for whatever program.
Right. Yeah. So the navigator will help the patient with all the paperwork, all the applications if needed, and then just follow up.
And many times those applications are incredibly detailed.
Yes.
And sometimes our navigators have to help them find the documents that are required for the treatment programs.
Right.
But believe me, we get them into treatment. One way or another, we're going to find a way to get them in. Yeah. So I think that would be very scary to suddenly have to come up with a lot of legal sounding documents, you know.
One good thing about our navigators is that, like I said, yes, they'll help the patient get through treatment, but they will follow the patient throughout treatment and then after as well.
And they also have many resources.
They do.
Knowledge about help with rent, help with food,
Right.
help with childcare. Yeah, so all of those things are needed when you're having to go to doctor's appointments. And, you know, no matter what, cancer is very expensive.
Right.
Just even having to go to a hospital or to the doctor's office every other week or something, it's really difficult. And so many of our women work. That's one of the things that people are surprised when I say, well, no, they're working. It's hard for them to get off work. I mean, that income means a lot to the family. So how do you, what do you actually say to someone when they go, oh, I don't want to take that time or...
Well, I mean, like I said, you know, women are providers. They're caretakers. So they have no choice. You know, they have to do it.
So you might reschedule someone 3 and 4 times before they can get off work? Or?
No. So we do have programs that offer assistance. So if they need to come in, if they don't have a vehicle, if they don't, you know, we have program. We'll find a way. And that's why I say the Rose offers access to care. We'll find a way to bring it to you or you come to us.
Right.
Yeah, through our mobile program.
Tell us what do people ask about when they call for an appointment?
Most of our patients call and they're just asking, I mean, of course, cost, but they want to be educated. What's a mammogram? What radiation? How am I exposed to radiation?
How do you explain a mammogram?
Well, it's kind of hard to explain when I've never had one myself.
Oh my gosh, you're just a child. I know.
Yes.
But you've seen the process.
Right.
You know the process,
yes,
of course.
Yes. So we explain it to them. And all of our call center is very well trained on, you know, how to educate the patients. Of course, we don't give them medical advice, right? But we let them know, hey, this is the process, this is how it works, how to prepare for it, and just make them comfortable.
So how do you explain the difference in a screening and a diagnostic?
So what we tell the patient, a screening is just to prevent, to check, to see if there's something wrong. Whenever you get a diagnostic done, is we're focusing on a specific area, and we want to see if there's something really there that we saw during your screening exam.
And, of course, that lady may have found something herself.
Right.
Or been to a doctor and they said, oops, you need to go get a mammogram.
Right.
So that's kind of hard. It's hard for anyone to understand why it's a mammogram. Why is it different? But, of course, in the diagnostic mammogram, the doctor is there and looking at the films in real time. And a lot of times a woman will need an ultrasound with that, that procedure.
Yes. So, so the physician, the doctor will be there with them, just guiding them through it. Same as a biopsy, and just giving them real time results.
Right. They're not going to have to wait on those.
Versus the screener, where, the doctor has to read it and it takes a couple of days. So,
Okay, so you've been very involved in a new system that we have installed, tried to implement. still implementing.
Right.
But tell us why that's going to be so important to the patient.
So once it's fully ready to go, the patients are going to be able to see real-time appointments. They're going to be able to schedule that through our online system. They're going to see shorter wait times at the centers. And
Can they do their sponsorship stuff on it?
we don't know yet. That's
Okay.
something that's
We still may need to have that
right.
personal one-on-one
Yes,
call.
right. Just because
Yeah.
it's more of a creating a relationship with the patient when we're talking to them.
They'll have their own portal.
They will, yes. So they will be able to see results for screeners and previous appointments, insurance information, and all that.
They're not going to have to refill out that piece of paper every time they come in.
Maybe, maybe.
But we always
So
have
it's
to get updates.
Right, right.
Yeah.
Yes. So it's an every year thing. That's just our, compliance. But it's once a year, and it shouldn't be as bad.
Yes,
Yes.
true. Well, and it's amazing how many people suddenly have a history, a family history. Their
Right.
sister or their mother was diagnosed, or they may have had personally something change that we need to know about. So, yeah, it's just like with any doctor's office.
no,
You have to do
definitely.
updates.
I know. Yeah. It's sometimes it feels like more paperwork, but we need to know what's going on. We don't know the patient, so the little bit that the patient gives us, that'll guide us to, hey, maybe we need to look at this, maybe we need to look at that.
So, are you excited about this new system?
I am.
And
I am.
it has impacted every one of your departments,
It has.
and probably almost all the departments that we have.
Yes. Our departments are resilient, and they are hard workers, and we're just getting used to it now.
So, how do you encourage your employees?
Well, it's new. It's new. So learn something new. It's modern. It's better for the patients. It's easier for us. I mean, you have to give them a little push sometimes, but it's going well.
So education's always been important to you.
Yes,
And I know you recently received a scholarship to
did.
continue your
I
education.
did.
So what do you ultimately want to do?
Well, I want to keep on building strong teams here at the Rose. I want to be able to lead strong teams, people that have compassion, people that understand others, and that follow our mission. That's my ultimate goal.
What is it that you wish for your own daughters? I mean, you had a very different kind of childhood.
I did.
Your parents did not speak English, and you had to be the translator for many things, not just healthcare, I'm sure. So what it is that you wish for your daughters?
Well, I mean, I tell them all the time, they don't have it easy, okay? But they have it easy in a way where they don't have to advocate for themselves. I'm here
Right.
for them. So I do hope, my ultimate goal is for them to, when they're older, to be able to speak up. If they have questions, speak up. Put their health first. And advocate for themselves. Always, always.
And even with all that you know, is that still hard for you, for yourself at times?
Yes, it is. I mean, even here, working here, sometimes I feel like I put myself last because my employees or my patients. But yeah, it's always in my mind.
Of course, you're surrounded by a lot of strong,
Very.
shall I say, hard-headed or determined women.
Yes.
Yes. Good for mentors.
Yes, definitely.
Challenging
Many.
to work with sometimes.
Many. Yes. Yes. Yes.
Yeah. So, what message do you want to say to anyone who feels like they need a mammogram?
Well, preventative care saves lives. So put yourself first. It's not selfish. Get your mammogram. Save yourself.
But why the mammogram? I mean, so few people realize that it's a very needed annual exam.
I don't know if it's an age thing where talking about breasts was very taboo. So I feel like many women don't think that nothing happens in the breasts, which is not the case. So, yeah, they might check their annual physical for anything else.
A well woman or
woman's, yeah, but they never think about the breasts, which is not good.
Even with all the awareness we have?
Yeah. So,
it's kind of like we're fighting the same battle.
right.
And is it hard to educate your own staff about breast care and what's involved?
It can be because, again, I've never had a mammogram before, but we do a lot of continuing education and we try to learn everything that's out there, on breast cancer and all that, so we can educate our patients.
What other message would you send, especially to someone who does not speak English? How would you encourage them to call us or get it done?
Well, I would say don't be scared. I know it's easy to say, but here at the Rose, like I said, we remove all those barriers, or we try to remove all those barriers. We have assistance.
Go over those barriers again. What are they?
So language barriers,
Okay.
transportation barriers, financial barriers. So transportation, we have a mobile. We'll come to you, Financial barriers, we have sponsorship programs. We have payment plans. And then language barriers. We have the staff that speaks Spanish. And if it's another language, we have translation services.
But one thing you can't teach is that compassion. How do you know when you're hiring someone whether or not they're going to fit in?
Well, most of my staff has either gone through some type of cancer, or they disclose, hey, I want to be here because of your mission, because of this, because of that. So most of my staff is compassionate because they've either gone through something similar or one of their family members have gone through something. So everybody understands when that patient's calling, when we're picking up that phone, hey, I'm scared. I found a lump.
That is so important. And even to be able to say it.
Yeah.
And especially to know that the person on the other side of that phone is really able to understand you. Yeah. So this coming year, you have a lot of things going in, a new system, a new way of serving our patients, and continuing with that mission like we have.
Yes.
Well, it has been a joy to have you here today, and I know that you have many, many patients call. It's something like 6,000-7,000 a year, isn't it? A month.
A month,
Just
yes.
through the call service.
Yes.
So if anyone calls and for some reason it takes a little while to get through, just keep trying.
Yes, definitely.
That's another message we really want to send out right now while we're in this transition phase.
Yes, definitely.
Anything else?
Nothing else. Just schedule your mammograms. I'll be waiting for your call.
Good. Thank you.
Thank you so much for having me.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.